Fighting the spread of COVID-19 requires extraordinary measures going by the burden of a disease on nations across the globe, Nigeria inclusive. Now, part of these measures was suspension of international flights sometimes back, but following the resumption of international commercial flights in Nigeria, the Presidential Task Force on COVID-19 (PCF) mandated passengers coming into the country to complete an online pre-boarding health declaration of a Nigeria International Travel Portal. They must have also tested negative for COVID-19 within 96 hours of their departure to Nigeria and have uploaded their PCR test certificates to the online travel portal. On arrival, passengers are also expected to be screened by port health authorities or officials and be required to provide full contact details, after which they will be required to present themselves for a second COVID-19 test within 7 days. To further confirm its commitment to the travel protocol, the Presidential Task Force on COVID-19 Monday released another list, that's the second one now, of 100 passports that have been suspended for 6 months due to non-compliance with a mandatory 7-day post-arrival COVID-19 test by their owners, in addition to a similar move in December last year. Now, what are the implications of these violations by travelers, and what are the consequences of a travel ban placed on the owners of these passports? Well, these are some of the questions our guest tonight will provide answers to on Nigeria Today. Welcome. The program is Nigeria Today again on NTA News 24. I am Musbadan Wahab. Welcome. Now, to discuss COVID-19 and travel ban, I have joining me again Dr. Mukhtar Mohammed, the National Incident Manager, Presidential Task Force on COVID-19. Dr. Mukhtar, good to have you again on Nigeria Today.
Good evening, viewers. Thank you for having me.
All right. Also in the studio is a familiar face as well, consultant family physician, Dr. Heme Ogbonaya, who is the medical director of Prime Care Hospital, Gwarimpa, Abuja. Dr. Ogbonaya, it's good to have you again.
Good to have you too, Wahab. Good evening, Abuja.
Very well. Now, let us start with Dr. Mohammed. For the benefit of the doubts, can you please establish what these travel protocols are for travelers coming into the country?
Okay, thank you. So when a person intends to come back to Nigeria, you are coming into Nigeria, you are expected to go to an accredited laboratory in the country before departure and get a PCR COVID test. This test has to be done in such a way that it is not more than 96 hours before you leave the country, which means at the time you are presenting it at the airport, it should not be more than 96 hours old. Now, 96 hours is 5 days, right? 4 days. Four days is 48 hours. 2 days is 48 hours, so 4 days, that is 96 hours. The problem is we had an adjustment. Before it was 5 days, now we have made it 4 days. So you submit this test result at the point of departure, and you also complete an online form, which is the Nigeria International Travel Portal. Now, you do this at home, or you can do it at the airport if you have internet. You complete the form. The form is basically a health screening form. It will ask you questions about whether you had fever, cough, or exposure to persons who had COVID-19. So you complete that form and also upload the result of the test result you have. That is fine. That's all you need to do. If you do that, you will be able to print your travel certificate, which is you have a QR code, and then you will have a permission to fly. We call it permission to fly. So you will be able to print that, and with that you can board on the aircraft and come to Nigeria. On arrival, you have our health personnel at the airport who will take your temperature and also maybe ask you a few questions. But even before you come, they would have looked at your form, they would have seen your results, and then there you will also present, hard copy of your result. They will check for authenticity, at least to make sure that it is a valid laboratory that provided you with that result. So that is all you need to do. Okay, then after that, you now go home. When you go home, you are expected to self-isolate, meaning that you try not to interact with many people outside your household. You don't go out to public places. You stay indoors and conduct most of your businesses just with people around in your family. So on the 7th day, you are expected to go to a laboratory that you have selected, that you can now test PCR again. And when you are negative, that is fine, you are good to go. But if you are positive, then we will need to provide you with more care and perhaps take you to isolation, or you can isolate at home and also get the necessary medication. So this is just the procedure that is required.
And as basic as that, right? Okay, thank you very much for the establishment, Dr. Mohammed. Now, Dr. Bonaya, you've listened to Dr. Mohammed Kili, I'm sure. When you compare these protocols with what we have around the world, or even some neighboring countries, do you think these are enough to check the importation of COVID-19 into this country?
Yeah, thank you. With due respect to the people that fashioned the protocol, I think they have done a great job to fashion this protocol, and as much as possible, if we should follow these protocols to the letter, I don't see why we're not going to check the spread, importation, or whatever you have of COVID, the virus, into the country one is visiting. A cursory look at what obtains in many other nations. Let's take, for example, other countries around the world. Like if you go to United Arab Emirates, for instance, as a standard,
yeah.
I think it's the same protocol. Once you come into any particular airport, for instance, you also get isolated into a cubicle where PCR is also taken, and all your details are gotten, and then you should be able to get your results within 24 hours to 48 hours period, and then of course you are expected to self-isolate. So I think the protocols we are doing are best standard practices, and like I said, I think the people that fashion the protocol deserve enough kudos on the back.
All right, thank you very much, Dr. Bonaya. Now, I asked Dr. Bonaya that particular question because coming from a background, we are aware of a country, particularly some neighboring countries in this West Africa sub-region, whereby on arrival, you have to take your sample. You must have registered before getting on board, and then when you get to the airport on arrival, you get tested, and before you get into the main hall, your test result is already waiting for you. Dr. Mukhtar, is this too much of something to arrange for in Nigeria to ensure that people get tested and get results even before leaving the airports?
So it depends on the level of rigor that you want to employ.
No, since it's becoming so difficult for people to comply with the simple rule of self-isolation for 7 days before going for tests.
So this thing is the tests, you have to interpret the test very carefully. There are rapid tests that you can do within 15 minutes or 20 minutes and you get your result.
Exactly.
Now, but these tests are not as accurate as the PCR test. The usual PCR test, to run it on a machine, and for the result to come back to the person, it will take you a minimum of 24 hours because the test itself runs about 8 hours with uninterrupted power supply. It is not something that you can do in an airport, right, where you have congestion, you have people coming to take their queues. So countries that are doing that rapid test, they are just doing a screening program, but they are not confirming. So for example, you can run a rapid test now. It can quickly pick someone and say, yes, you are positive. But you go and do a PCR, it will tell you, no, you are negative because of the sensitivity of the test result. Now, we have considered all this in Nigeria. Number one, we looked at our airport space. We do not have enough space to be able to be running these PCR tests in the country. And one of the things we did was, if you look at Nigeria now, we have only 2 airports that are open, Lagos and Abuja. Right. We do not allow the other airports because we want to have good control and also provide the due process and diligence at the airport to make sure that the right things are done. So the space is not available, number one. Number two is the quality of the test. The pre-boarding test ensures, if you do a PCR before test, at least it is given some assurance that this person that tested as of the time of the test, is not COVID positive. And therefore that eliminates you from even coming on board to infect other people who are coming into the country. That is what we call the window period. So since we need your results 96 hours before getting on board, it means you have spent another 3 days or maybe 4 days afterwards, and there's a possibility of getting infected during that period. Now if you get infected during that period, it's not going to show immediately. It will have to go through some period before the testing will be able to pick it up. So that is why after arrival we give that window of about 1 week. Now by that time we're almost 95% certain that if you had COVID infection, that you will be picked by that 5th day or by 7th day. Will be 95% certain that we will detect your case. So actually what we are doing in Nigeria is one of the best practices. Countries that are not doing that, we see now they are trying to revert to doing it. In Europe, a lot of the countries have introduced pre-boarding and 7-day testing. In UK now they have pre-boarding and they now have 5-day testing. So it was very much thought of, and we think it is really the way to go. But certainly with advance in technology, once we have the PCR results that can be read within a shorter period, we can have an arrangement where it can be done as soon as somebody arrives.
All right, thank you very much. The things you just confirmed that the rapid test cannot be so accurate or 100% reliable. But what about taking the samples from on arrival at the airport? Is that too much too?
So taking sample on arrival at that point in time, you are not sure if that person is within that window period.
All right.
So even if you test, a negative result does not actually confirm that the person is really negative. So you have to wait until after that 5 days and then you test. And we are doing 7th day. So 7th day even give you a higher sensitivity than the 5th day.
Yeah, thank you very much, Dr. Mohammed. Now, Dr. Ogbonaya, people certainly know about this, the presence of COVID-19 and the second wave that we say it's very wavy as we speak. Now, why do you think people are violating these protocols? Because we have had recently a case whereby someone apparently found his way to navigate or evade testing from Nigeria and then getting into other country, not only affecting a partner but also giving us life in the process. In the end, why do you think people are evading these protocols?
Okay, I think it's more of the fact that some people may likely want to live in denial, because there is so much stigma associated with COVID-19. Stigmatization from loved ones, from neighbors, from family, and all whatnot. So a lot of people may likely want to live in denial. Some of them will, also have this notion that COVID-19 is fatal. So they wouldn't want to first and foremost accept the fact that they are COVID-19 positive. I wouldn't want to also explore the fact that there could be some form of mischief also associated, with this, evasion of tests, the mandatory test, and wanton spread of these infections to people they come in contact with. But by and large, I think more people still need to be sensitized about the dangers that lie in in not just going to get tested, and then of course knowing your status, and then not know what next to do. Are you going to get isolated? Are you going to get treated? Whatever the outcome is, I mean, one needs to really be sensitized and then know the dangers portends by not actually subjecting yourself to the screening test.
Thanks a lot, Dr. Bunaya. Now, I'm still going to stay with you, but now we still have so much to talk about. Let's quickly take a break, and we'll come back to talk more about the way forward on this.
Based on the protocol for the band or something, I think they should really enforce it so as to control the spread of the virus.
The federal government is trying all this while.
In a sense, they are right, because they have to watch out for the safety of the public.
Things have to go in a right way, because if you want sanity in the health sector, as far as Nigeria is concerned, it should not be affiliated with other people from outside the country.
All right, thanks a lot for staying with us. If you're just joining us, it's about time the program comes on for the second segment, and then I still have my guests in the house, Dr. Bunaya and Dr. Muhammad. Now, Dr. Bunaya, let me stay with you. You've just listened to a cross-section of Nigerians in the Federal Capital Territory. We cannot say what people in other parts of the country do understand of this situation, but do you see these people getting along with the government on this issue as it affects the fight against COVID-19?
Well, I'm still in shock, especially with the fact that majority of people are still living in denial, are still living in crass ignorance as far as COVID-19 is concerned. A lot of people are still with this wrongly held notion that COVID-19 is a myth. I still hear people call it pandemic, all kinds of funny names, they ascribe to COVID-19. So I don't see much cooperation in the short term from most inhabitants, especially with the fact that like what we hear, what we watch on internet, happening across the globe, the mosques filling up, the deaths and so on and so forth everywhere. I mean, we don't seem to see much of those figures around here. So many people will still keep living in this notion that as far as they're concerned, COVID-19 as is being portrayed may not actually be as fatal, may not actually be as real, may also be government's own way of scamming them and imposing unnecessary hardship and lockdown, as the case may be. So when such wrong notions keep instilling in people's heads, I mean, you don't expect to have people comply with basic protocols, hand washing, wearing face masks, social distancing, and the rest. I mean, these are things that you see them most of the times they get to be forced, coerced to involve themselves in such practices, and this shouldn't be. I think that by the time a lot of us get more schooled, get more educated on the reality of COVID-19, I mean, more people get to visit hospitals, as the case may be, see how people actually die from infections of COVID-19. I'm sure the message may actually come closer home, and then people may as much as possible, without being compelled by all such means, try to as much as possible to comply with those protocols, and I see the figures actually coming down when that time really comes.
Honestly, Dr. Bunaya, I'm still wondering how else people will be schooled on this, the significance or the magnitude of this disease around the world. But now, Dr. Mukhtar Mohammed, we got here apparently because of inaction or action that were not taken on time when we had the index case of an inbound traveler who came in through Lagos and then went to Ogun State. And now we're still having people evading post-arrival tests. What other measures is the PTF now thinking of taking to ensure compliance with these and other COVID-19 safety protocols?
So absolutely, I think the government actually acted on time by setting up the PTF itself and by quickly moving to close down our air travel by 23rd of March. So that was really an important milestone that really helped to curtail the influx of more positive cases. Now, regarding people who try to beat this protocol, yes, let people understand the harm they are doing to themselves, to their families, and also to their communities. When you evade doing a COVID-19 pre-boarding PCR test, or you just find the easy way, you go to the airport, connive with other people, and you procure a fake COVID result. Now what you are doing is you are letting yourself come into the country now, but your health status is not ascertained. You can be positive and you can be negative. Now from the airport, where do you go? You are going to your loved ones, you go to your home. Now if you had detected you are positive, certainly steps would have been taken. You wouldn't have come to spread the infection in your family. And if you arrive in Nigeria and you refuse to do the testing also on day 7, you are also causing further danger to your family, because there is that small chance that even though you are negative before departure, you could still be in the window period and now manifest as positive. So they'll continue to interact with you and will continue to spread the infection. Now the danger is, if there are, the people in your household will get positive. If there are people who are vulnerable, who have disabilities, who have obesity or diabetes, or they are old, they can get the infection, and for them we know it is very severe and can even lead to death. So the PTF has taken this very seriously. Number one, people who violate this protocol are offenders and they are liable to prosecution. That's number one. So apart from the prosecution, we will also quarantine you. Right now there are about 6 people who came into this country with fake results, and we have quarantined them. Some of them have jumped quarantine and they ran away. So we are going to get them, we're going to put them on wanted list, we're going to prosecute them, and they will have to pay for the quarantine. They will have to pay for the hotel for 7 days, they will have to pay for their feeding, and they have to pay for the testing. And after all this, they will not be prosecuted again. Now, we don't want to go that way. I think it is better people understand the import, of doing this test and following the regulation and ensuring that people around them remain safe.
All right, thank you very much, Dr. Mohammed. Now, Dr. Ogbonnaya, Dr. Mohammed just talked about false results that people are carrying around. How do you think we go to this level whereby people now begin to look for means to circumvent the protocols and the normal procedures of getting out or in to the country? What else do you suggest that the PTF should do at this moment to check this?
Well, I think the issue of getting fake results stem from two, should look at it from 2 angles. The issue of people being desperate, maybe the traveler, the intending traveler, being desperate to travel because probably he or she is considering how much he has put in booking his flight, how important the journey the trip he's making is to him. So he wouldn't want a situation whereby a positive test will maybe stop him from fulfilling those ambitions of his. So he could go out of his way to look for collaborators who will help him doctor his results to enable him to to fly. And then on the second part is the person who actually procured the negative test. Maybe in this instance now we're looking at probably the health practitioner, the laboratory, and so on and so forth. Now some of them can also be led by greed, because they are looking at this person being desperate, acting on his desperation, that they are able to make some quick bucks here and there. So we look at, these are part of the reasons why there seems to be an increase in the number of negative results, and fake results and certificates that are flying here and there. So I think what PTF has done so far of making sure that the results are that are going to be used not only emanate from NCDC, but are also from very well accredited laboratories, yes, as the case may be. So I think that was a good move in the first place. But the fact still remains that, you know, the human factor will always remain. The fact that some of these laboratory centers are allowed to, you know, you just did the first inspection, you know, give them all the right act for them, and then they complied initially, and there are no more follow-up visits, no more rigorous, follow-up, of their practices. And of course, once the issue of greed comes in, the business part, they want to make, quick bucks, be able to make ends meet, pay their staff, pay for all kinds of services. I mean, pay for all kinds of
and for other reasons.
Sure. So there is always a chance, a real likelihood that they may want to cut corners once in a while just to make that make that a reality. So I think PTF also still has some role to play, apart from the fact that some of these labs have gone through the necessary accreditation, gone through the medical lab science, FCT, public health, and PTF themselves, NCDC as well.
Thank you very much, Dr. Ogbonaya. I believe PTF will continue to evolve other means to check this menace and the disease from spreading around the country. Dr. Iheme Ogbonaya, consultant family physician and medical director of Prime Care Hospitals, Gwarimpa, Abuja. We really appreciate you for coming.
My pleasure always. Wow.
Dr. Mukhtar Mohammed, the National Incident Manager, Presidential Task Force in COVID-19. It's been our pleasure to have you this evening on Nigeria Today again.
Thank you, Mr.
All right, thanks for watching Nigeria Today. The program returns at 7:30 tomorrow in the evening, but you can always watch these and other editions of the program on youtube.com/NTA News 24 Hub. My name is Muspa and Wahab. Continue to stay safe.